Good afternoon, class.
Good afternoon, Mr. Fornan. How are you doing?
I'm doing great, thank you. In today's class we will be discussing cardiopulmonary resuscitation as a topic. But before we start, who can tell us what CPR is?
Yes, Mr. Forna.
Yes, Ms. Abunata, go ahead.
CPR simply mean cardiopulmonary resuscitation.
Good, Ms. Abunatu. Now take down the definition of CPR. Cardiopulmonary resuscitation can be defined as an emergency life-saving procedure performed when the heart stops beating. Immediate CPR can double or triple chances of survival after cardiac arrest.
Wow. But why do first aiders perform CPR?
Well, Ms. Abunatu, that will take us to the importance of CPR.
Okay, Mr. Forna.
Now to the importance of CPR. It helps keeping the blood flow active, even partially extends the opportunity for a successful resuscitation once trained medical staff arrive on site. Now we are going to discuss the 7 steps of CPR in order. A brief summary of the steps of CPR are as follows. Check for danger, call for help, check the victim's airway, give 2 rescue breaths, perform chest compression, switch roles with the compressor if available, and continue compression until advanced medical help arrives. If you find yourself in a situation where someone needs CPR, don't panic. Just follow these simple steps and you'll be helping to save a life in no time.
Wow. That is so wonderful. Mr. Forna, would you please tell us more about the CPR procedures?
Of course. The first step of CPR is to call 911, or for Sierra Leone, call 117. After calling the emergency line, make sure you give the person cardiopulmonary resuscitation if needed. There are numerous techniques, and it is important the correct one is used for maximum efficiency. Remember that time is of the essence with these situations, so don't panic and take appropriate action as soon as safely possible. The second step of CPR. Place the person carefully on their back and kneel beside their chest. Tilt their head back slightly by lifting their chin. Open their mouth and check for any obstructions, such as food or vomit. Remove any obstructions if it is loose. If it is not loose, trying to grasp it may push it farther into the airway. Reaching into a person's mouth to remove an obstruction can be dangerous, so it is important to be extremely careful and use special tools designed for this purpose. The third step is to check the person's breathing and pulse. In order to administer CPR properly, you first need to check whether a conscious person is still breathing or has a pulse by feeling the side of the neck. If the person does not have any signs of breathing or circulation, CPR must be started right away. Knowing CPR is an incredible valuable skill to save many lives, so it's important for everyone to learn how it works. Step 4. Place your hands on top of the other and clasp them together. With the heel of the hands and straight elbows, push hard and fast in the center of the chest, slightly below the nipples. Push at least 2 inches deep. Compress their chest at a rate at least 100 times per minute. Let the chest rise fully between compressions. Step number 5. Perform 2 rescue breaths. Making sure their mouth is clear, tilt their head back slightly and lift their chin. Pinch their nose shut, place your mouth fully over theirs, and below to make their chest rise. If their chest does not rise with the first breath, retilt their head. If their chest still does not rise with the second breath, the person might be choking. Step number 6. Repeat the cycle of 30 chest compressions and 2 rescue breaths until the person starts breathing or help arrives. If an aid arrives, carry on performing CPR until the machine is set up and ready to use.
Wow. This is great.
Well, that is the end of our class for today. Any question?
Yes, Mr. Forna.
Yes, Ms. Abunatu, go ahead.
Mr. Forna, during your presentation you earlier mentioned on the 5th step of performing CPR that the first aider should fully place their mouth over the victim's mouth.
Yes, I did.
In such process, if the victim has an infectious disease, would that not be a dangerous procedure?
That is true, but remember I told you in the 2nd step that reaching into a person's mouth to remove an obstruction can be dangerous, so it is important to be extremely careful and use special tools designed for this purpose. I think that is it.
Well understood, sir.
Well, that is how we are going to end our class for today. See you next class. Thanks for watching. I am Abubakar Forna. If you find this video helpful, please don't forget to like, comment and subscribe to my YouTube channel.